Hello, I'm Dr. Paul Smith. Thank you for joining me for another one of my educational modules. This one is on infertility. Many people are excited about becoming parents, and when a couple has difficulty achieving pregnancy, there are some issues that we can identify that might help solve that issue and bring them into the OB clinic. So I want to talk for a few minutes about the type of process we go through in evaluating a woman's chances for becoming pregnant. We go through kind of an anatomic stepwise fashion, and we start with the guy. 40% of couples who have difficulty getting pregnant have a male factor, and that can be either low count for sperm guys or low motility. There's a combination of factors, but when we are investigating getting pregnant, that's one of the initial data points we like to solve so we know what the issue is. Next in the geographic progression is the cervix. Is there anything related to the cervix that can interfere? Someone who has had an abnormal pap test and has had a procedure to the cervix can interfere with the geography or the opening. The cervical mucus is important for transporting those spermy guys up toward the fallopian tube and up toward the egg. So the cervical environment is next. Then we talk about the uterine environment. Is it normally configured? Are there fibroids which can create a lump of tissue that is a place where a fertilized egg can't land and can't grow? Is the uterus normally configured? Is there an abnormality of the uterus that will prevent an egg from implanting or prevent the uterus from growing and stretching and allowing the fetus to grow? So the uterine factor is next in line. Then we go out to the tubal factor. Does a woman have a history of endometriosis? Have there been any infections in her pelvis? Has she had a ruptured appendix? Is there something in the pelvic environment that would interfere with the fallopian tube getting close to the egg to help transport that egg where we want it to go? Normal pelvic environment, normal intestines are like slippery spaghetti. It slips and slides all over the place. After an infection or after endometriosis or some other conditions that can cause scarring, you can develop starchy spaghetti, and those organs can't move and can't get to where they need to go to help with that process. So tubal factor is next, and then we go to ovarian factor. Is the ovary releasing an egg every month? Is that egg at a predictable time in the cycle when a couple knows when to fool around and zap the egg? Is that egg a ripe follicle? Is it healthy? Is there enough hormone that continues after the egg is released to support that pregnancy until the placenta is big enough to provide the hormones for a successful gestation? So when a couple presents and says, help me get pregnant, I go through a stepwise series of questions and a physical exam so we can identify which factors, male, cervical, uterine, tubal, ovarian, where can we find something that can help you in your quest to become a parent. Thank you for joining me, and I hope to see you in my clinic soon.